Today I will be talking about breast cancer. We all know that breast cancer is the most common cancer in women and it accounts for 27% of all cancers occurring in Indian women. The incidence begins to rise in early 30s and the peak age is 50 to 64 years. Breast cancers are more aggressive in younger age group and also very fast progressing. Overall, 1 in 28 Indian women are likely to develop breast cancer during her lifetime. With lot of urbanization and late marriages, we are seeing that the incidence is more in the urban areas, that is 1 in 22 women, as compared to the rural areas where 1 in 60 women may have breast cancer. The most common sign of breast cancer is a lump or a thickening in the breast, and this lump is usually painless. There could be clear or bloody discharge from the nipple, retraction or indentation in the nipple. There could be flattening or indentation of the skin which is over the breast, and change in the size and contour of the breast can be seen. Redness or pitting of the breast skin like skin of an orange. Then we also know that the breast tissue changes naturally also during pregnancy and the various days of the menstrual cycle. There could be other reasons also rather than cancer, like fibrocystic adenomas, cyst, fibrocystic changes, infection, injuries, which can cause to these symptoms. But if you are having these symptoms, you should be alert and consult a doctor. What actually happens in breast cancer? Some of the cells in the breast begin to grow abnormally. These cells divide more rapidly than the healthy cells and they spread, that is, they metastasize through the breast, to the lymph nodes and to the other parts of the body. The most common type of breast cancer begins in the milk producing ducts, although cancer can begin in the lobules or other breast tissues also. Breast cancer has certain specific risk factors. Number 1, age, sex, family history, genetic predisposition. You actually cannot change these factors. These are non-modifiable factors. Only 5 to 10% of the breast cancers are inherited. Families with genetic defects in one of the two genes, that is BRCA1 or BRCA2, have much higher risk of developing breast cancers. Early onset of menstrual cycle, late menopause, that is you have been exposed to the estrogen hormone for a very long period of time, then probably you have more chances of breast cancer. There are certain modifiable risk factors like excessive weight, poor diet, radiation exposure in childhood or during adolescence when your breasts are actually developing. This causes increased risk and acquired mutations. Mutations may also develop as a result of exposure to cancer-causing chemicals such as aromatic hydrocarbons which are found in the tobacco. All women who are smoking, they are at a higher risk, and who are eating charred red meat. If you have a pregnancy at a very late age, like 30 years and beyond, less number of children, you are being put on hormone therapy or birth control pills, you are excessive smoker, excessive use of alcohol, and if you have precancerous breast changes like atypical hyperplasia, lobar cancer in situ, or if your mammographic breast density is more. Breast cancer can easily be preventable and detected at an early age if you do a self-breast examination regularly after the age of 20 years. You get a clinical breast examination by a gynecologist. Then there are mammograms which can detect breast cancer. Even a small nodule can be detected by a mammogram. Computer-aided detection is there. MRIs and breast ultrasound are good modalities for detection of breast cancer at a biopsy, fine needle aspiration biopsy, screening test, and genetic staging can also be performed. We talk about healthy lifestyles. The food is also very important. There have been certain researchers which have proved beyond doubt that intake of retinoids like carrot and all those things which are rich in beta carotene actually decreases the incidence and multiplication of the cancer cells. And similarly, consumption of flax seeds which have high content of lignin are usually compounds that actually lowers the estrogens in the body, and it decreases the estrogen production also. These act like tamoxifen, which is a drug which we normally give in patients who are having breast cancer. So they actually inhibit the growth of tumor cells. Although this is one of the most dreaded cancers for females, To be very optimistic, I would like to tell you that over the last 30 years, medical science has made great strides in the early diagnosis and treatments, hence reducing breast cancer deaths, right from radical mastectomy, segmental mastectomy, simple mastectomy, axillary lymph node dissection, radiation therapy, chemotherapy, reconstructive breast surgeries, hormonal therapy. But last but not the least, prevention is definitely better than the cure. So take care of yourselves. Thank you.